During your clinical rotations, you will be required to choose your own patients. This involves looking at the patient's chart to gather pertinent information and filling out a nursing process worksheet, or NPW. I am going to show you different parts of the patient's medical record using the virtual clinical excursion. Here are the steps to get you started. Begin with the patient's cardex. The cardex is not part of the patient's chart. It is found in the nurse's station. The cardex is a file card that lists important information that the healthcare team needs to know about the patient. You may also find computerized cardex in many facilities. Patient information you will find on the cardex include the patient's name, medical record number, room number, sex and age of the patient, the admitting physician, and your patient's medical diagnoses. Additional information you will find are the patient's medical history, allergies, and code status. You may begin to fill out your nursing process worksheet with these basic information. The cardex also includes information about the daily care of the patient. This may include the patient's diet, IV therapy, intake and output orders, and activity. This also includes the patient's ordered laboratory tests, blood sugar monitoring, procedures and treatments, consults, and any referrals that are ordered for the patient. Because the daily care of a patient may change, the cardex is usually updated on a daily basis. For the same reason, it is possible that the cardex may not be updated. Make sure that the information is current by comparing them with the physician's orders in the chart. Continue to fill out your NPW with the information you obtained here, after confirming that all information is correct. Next, obtain the patient's chart and turn to the History and Physical tab. There is a lot of information found on the History and Physical, such as chief complaint, history of present illness, allergies, past medical history and surgical history, GYN and OB history, social history and family history, medications your patient is taking at home, a review of systems, a physical exam performed by the physician, the assessment or impression, and the plan of care for this patient. In choosing your patient, focus on 3 areas of the history and physical. Focus on the history of present illness at the beginning of this page, and the assessment or impression and plan at the bottom of this page. First, let's look at the history of present illness. This section describes the patient's symptoms or problems in chronological order from the time of onset to the present time. It also includes an analysis of the patient's symptoms and any treatments the patient may have received prior to this hospitalization. Complete the HPI portion of your NPW from the information you obtained from this section. Now let's look for the admitting diagnosis under assessment or impression. This is located at the bottom of the page. So under assessment or impression, your patient may have a problem list that includes multiple admitting diagnoses and multiple chronic diagnoses like the one you see here. Complete the admitting diagnosis and medical history portion of your MPW with the information you obtain from this section. The patient's plan of care is listed under Plan. It will give you an idea of how the physician plans to treat or address the problems listed under Assessment and Impression. You can review the rest of the history and physical later on as you get to know your patient. Now look at the physician's progress notes. The physician's notes or progress notes will provide you with information regarding the patient's condition or progress, including any further or additional impression or plan of care written by the physician. The progress notes are usually documented in a narrative format, such as this one, or in a SOAP format that includes the subjective and objective data, as well as the assessment or impression and plan for the patient. Read the progress notes to find out the patient's condition and any changes to the patient's plan of care. You may read the physician's progress notes for today or the previous days. This will give you a picture of the course of events that have occurred during your patient's hospitalization. The course of events in the hospital are significant events that occurred during the patient's hospital stay. This may be obtained from the H&P, the physician's progress notes, and the diagnostic reports. By looking at these three areas, you will be able to summarize significant events leading up to your day of care. Let us look at the history and physical and progress notes to summarize a course of events for this patient. From the history and physical, write down any significant information from the impression and plan. So I'm going to scroll down at the bottom of the page to look at the impression and plan. Again, here is your patient diagnosis, and this is the plan of care for your patient. So we know that the wound has been cultured and the patient has been started on antibiotic therapy. The wound care team will evaluate the patient for wound treatment. The patient is started on medications for alcohol withdrawal. He's also on a sliding scale insulin coverage for blood sugar maintenance. Okay, now let's look at the physician's progress notes. I see here that the wound culture indicates that there is a Staph aureus that is sensitive to a certain antibiotic, and that antibiotic order will be changed as appropriate. Physical therapy will be ordered for evaluation for this patient, and also the wound care team is here to see the patient today. The patient is also scheduled for a bone scan. Let us look at the diagnostic reports. When you're looking at diagnostic reports, go down to the impression. Number one, look to see what type of exam it was. So this was a bone scan, and the impression was that this patient has osteomyelitis of the left malleolus. So in summarizing the course of events in the hospital, I can say that this patient is a recently diagnosed diabetes type 2 patient, started on insulin sliding scale. The preliminary wound culture was positive for Staph aureus. The x-ray reveals osteomyelitis of the left malleolus, and the patient has been started on IV antibiotics. The wound care team has seen the patient, and he has been started on a wound treatment. This is an example of the course of events obtained from the patient's history and physical, progress notes, and diagnostic reports. Again, ask your clinical instructor for assistance if you're having difficulties with obtaining the course of events in the hospital. Look at the Physician's Order tab. Here you will find the doctor's orders such as treatments, consults and referrals, procedures that are included in the plan of care of the patient. Other treatments include INO orders, oxygen treatment, and Foley catheters. When looking at the physician's orders, note that the top pages are the most current orders. Notice the date and time of each order. Look through these pages until you see the admission orders. Here you see the admission orders for the patient. This is where you compare the information you found in the cardex against the physician's orders. Look for any treatment orders and fill out the treatment section of your NPW. As you go through the orders, note any additional or change in orders. Go through the newer orders at the top pages and see if there are any changes in the original admitting orders. For example, in the admission orders, there is an order for a wound care team to evaluate the patient's left foot wound. As you go through the top pages, you note that there is a new order for wound care and dressing change for this patient. Write this down on the treatment portion of your NPW. Next, look at the Laboratory Reports tab. It is important to remember the patient's diagnoses when looking at the laboratory results. Let's review the patient's diagnosis by looking at the history and physical. I'm going to scroll down to the impression at the bottom of the page. The patient's assessment or diagnosis is cellulitis of the left foot with osteomyelitis, type 2 diabetes, alcoholism, and nicotine dependence. Now I'm going to your Laboratory Results tab. First, look at the lab results and note any abnormal lab data that are significant to the patient's condition. This patient has cellulitis and osteomyelitis. Therefore, I am concerned with the WBC and the differential counts. Note that the WBC, neutrophils, segs, and bands are elevated and have increased from the day before. The glucose is also elevated because the patient has type 2 diabetes and has an infection. The sodium and potassium are elevated, but notice that they have decreased from the day before. Because the patient has alcoholism, write down the liver function tests, such as the AST and the ALT. I also see that this patient's hemoglobin A1C is elevated, and that his urine has 4+ glucose and moderate ketones. This is significant because he does have a history of diabetes. So let's review. First, you look at the latest laboratory results. Note any abnormal lab results significant to the patient's condition. Trend the lab data by comparing the latest lab result with the results from the previous day. It is also important to note any normal laboratory results that are significant to the patient's diagnosis or condition. For example, if this patient recently had surgery, I would write down the WBC, RBCs, hemoglobin, and hematocrit, even if they are normal levels. These are labs you would monitor for in a patient who had surgery. If a patient has a history of chronic pancreatitis, look at the amylase and lipase. These are the normal laboratory results you would look for in a patient with pancreatitis. You will look up these laboratory tests at home and explain in your NPW why the results are increased or decreased. Correlate them to your patient's acute and/or chronic diagnoses and explain them in your NPW. Lastly, you will look at the Medication Administration Record, or the MAR. The MAR lists all medications ordered for your patient. Complete the medication portion of your NPW using the MAR. Note that the MAR in the patient's chart are expired MARs, meaning they were MARs from the previous days. You may use the expired MAR sheet to copy the meds ordered for your patient to fill out your NPW. If you are scheduled to administer medications, it is important that you ask the nurse for the current MAR. Once you have the current MAR for your patient, compare the old MAR with the current one. Add any additional medications found in the current MAR in your NPW, if any, and verify all medications against the physician's orders in the chart. Some charts have a medication reconciliation sheet. This sheet lists the patient's home medications. It will state if the patient is to continue the medications in the hospital as per the physician's orders. It usually provides a list of patient's current medications, including prescription, over-the-counter, herbals, vitamins, and others. Look at this sheet to determine if the patient is going to continue his or her home medications while in the hospital. You are now ready to choose your own patient for your clinical rotation. Practice navigating through a chart using the virtual clinical excursion until you get comfortable with the process. Review the different parts of the patient's chart as you care for the patient throughout the shift. And lastly, please ask your clinical instructors for assistance if you're having difficulties. This concludes the standard clinical preparation.